Thank you, Dr. Heinzinger, for meeting with us today and talking a little bit about physical therapy. To start off, what is your background and educational training?
My background, I graduated from Seton Hall, Graduate School of Medical Education as a physical therapist, a doctor of physical therapy. Went to undergrad at Kane University pre-PT. So again, all your general education needs, science-based, all that kind of thing. Our university at Seton Hall is more of an orthopedic-based type program, so a lot of hands-on, a lot of manual techniques. Again, we do get the broad global education, but again, mostly focusing on that orthopedic section.
Nice. Okay. How long was the program at Seton Hall?
Program's 4 years, graduate education. So it's a year longer than most of the graduate programs in New Jersey. Stockton and UMDMJ are 3, but we get that additional last year of just a full-time internship, or they call it our residency, where we're working full-time in a setting for 40 hours a week for 3 months.
That definitely helps. How did you become interested in physical therapy as a career?
Well, that's a long story, but I'll abbreviate it for you. I didn't go to college right after high school. I decided to go and work, and I was an administrative assistant for 2 years until I was 21. Decided I needed to go back. Wasn't for me. I needed something different. So full steam ahead, into just general education courses. Took every single test to try and figure out what I would be good at because I was still uncertain. And I had a girlfriend of mine who actually was going to school for radiology at the time. And she said, you'd probably be good at physical therapy. She's like, I pass by the gym all the time. And she's like, and you love to be active, do your workout all the time. She's like, you should check it out. Now, I had no idea what physical therapy was. So I went to Monmouth Medical, where my cousin worked as the receptionist in the rehab department, coincidentally. And I did a 6-hour observation with one of the therapists there.
Nice.
Was really interested, got to see a lot of outpatient, inpatient type patients. But then I was able to sit in on a very personal treatment from a woman who had lymphedema, who could not walk because it was so congested in her legs. And she allowed me to sit on the hour treatment. The therapist did her lymphedema, massage and ACE wrapped her. And by the end of that session, she was able to walk out of there. And she continued to walk that day for, the next few hours. So the impact that it had on someone's life and just being able to, give them a better quality of life really set a good impression on me. And I said, you know what, that's what I want to do, and never looked back, and here we are today.
That's really a great story. I never knew that. How long have you been in this field?
I've been in the field 4 years practicing. I'm going on 5. But during my undergrad and into my graduate work, we had to do volunteer hours. So I volunteered and, got all that out of the way, but then I stayed on with the outpatient facility, physical therapy practice, and worked with them from undergrad all the way through graduate school. So I got to see a lot. So I feel like I've been doing this, for a very long time, probably upward of, oh my goodness, I would say like 7 years.
That's awesome.
Just being in the field, seeing it, working on the front house end of it, the, paperwork, insurance aspect, front desk.
It's a nice balance of it all.
Back in the back, and, really seeing what goes on through treatments.
Very nice. So as a doctor of physical therapy, what would you portray to somebody as being the benefits of physical therapy?
There's so many, I know it sounds cliche, but you move it, you lose it. That's totally 100% true.
Yeah.
The benefit is just being healthy, decreasing muscle imbalances, keeping up with joint health, bone stimulation, pressure on, pressure off, stabilization of joints, just keeping the whole body healthy from, muscle to tendon to bone. Cardiovascular health, neurological type influences, it's huge from every spectrum, from, cardiopulmonary to, stroke to total brain injury to kids with autism and cerebral palsy to your just common outpatient, post-surgical people. So, I mean, it's a huge impact, a huge influence, because everybody likes to, well, some people like to work out, but the fear of certain things and not being guided in the right direction, the physical therapist can do that for you. So it's
its
benefits are vast, I think.
Of course. Are there different types of techniques or treatments that you offer here in physical therapy, and can you just talk a little bit about them?
Sure. Well, I'm a manual therapist. There's some that aren't, there's some that are. So things vary a little bit. It's not just instruction and exercise and stretching. I really get in there, mobilize the joints, do your grade 1 through your grade 5. Mobilization techniques, mobilization with movement. So I integrate a lot of different methodologies from Syriac to Mulligan to McKenzie. So I think in order to get a better result, you need to encompass a lot of different techniques versus just being one-minded and saying, okay, this is the only road to do it. There's many roads because, all of our joints are going to respond differently to different techniques. So, a lot of those, I like to implement a lot of those to get the best results. I do a lot of taping with the kinesio tape and the McConnell tape, if warranted. Again, a lot of patients like it, get good feedback from it. I also do the decompression. Been working with the hot laser, which is, cut treatment times considerably down for, disc issues and things like that. And just your general, conditioning, getting back to being healthy and increasing your endurance. I've always been a fan of multidisciplinary, whether it be in a hospital setting, in the outpatient setting. I've always been drawn to the acupuncture, chiropractic, because we all have something in common. We're all trying to get to the same end result. And sometimes there's more of a need for maybe an adjustment that I necessarily wouldn't be able to approach or get at. And then the same thing with acupuncture. Sometimes there's a lot of muscle guarding that goes on, and that just takes the time to relax the patient down, bring about a sense of calmness and also health to the overall body, mind and body. So I've always been a big believer of that, because we found that it works really well with patients. If they're receiving acupuncture and physical therapy, if they're doing chiropractic and physical therapy and chiropractic, overall the recovery time and their prognosis is accelerated, and we're seeing them get through their treatment plans more successfully in less time. So I think that's an overall benefit when you have all of those things working together. And most of the time patients are doing those things, maybe not in a group setting, but they might be doing it isolated in different practices. So they're still looking for, all those avenues and combining them on their own. But I think it's beneficial at Marin Wellness Center because we offer it to you, and we're actually evaluating you each time and saying, okay, you might benefit from this, and it may not necessarily be me. So I would always say, like, maybe come back to physical therapy, or maybe go back to chiropractic, maybe go back to acupuncture. So you're always reevaluating and assessing the needs of that patient and doing what's best for them. So I like that whole approach.
So what are the most common injuries or cases that you've come across in physical therapy? Is it more post-surgical rehabilitation, or is it just general, back pain, neck pain? Is there anything that you've noticed throughout the years that is happens more?
I would say predominantly, obviously your surgical cases are always going to be there, but I do notice a huge influx of low back, cervical, and also shoulder issues. Those seem to be the most common that you see that aren't necessarily surgical interventions at first.
Just every day.
So, and that again goes into just kind of in our work settings. Most people are sitting, most people are at a desk, traveling, in the car, all that postural change, we call it the upper cross and lower cross syndromes, where, you're getting into that almost like fetal position, that causes a lot of strain on those areas, a lot of disc herniations. I've seen a lot of that. That seems to be predominantly what's been going on with the general patient population.
How do you continue to remain current and up to date with new techniques and treatments that come across in physical therapy?
Well, currently I'm actually working towards my Certified Integrated Manual Therapy certification through Great Lakes. So I'm a manual therapist, so I like to integrate a lot of those techniques, and that's an ongoing learning process. So, given my background they gave us a solid foundation, and this is building upon those techniques that we learned. So it almost comes naturally, but again, it's also confirming, what I've been doing
Right.
and giving me more. So I've been doing that. I'm also an APTA member for the orthopedic section of New Jersey, the New Jersey chapter. So I'm constantly getting my journals, and I read the evidence-based research a few times a month. So I pick out the most relevant articles that pertain to the outpatient setting, and then really implement what's being seen out there into practice right now. So I feel like that's the most relevant, because that's where our profession is pushing for,
right.
And it's very vital for each professional to do that, so that they know that what they're doing is effective, and we have the research to support it.
Nice.
Then in conjunction, continuing ed, I don't just do the minimum that's state required. I actually go out and do a lot more on my own.
That's awesome.
So I'm doing upward of sometimes 60 plus per year.
What is the requirement?
Requirement for the state of New Jersey is 30.
Okay.
So you have to do 30 contact hours, and then you have to have your ethics and jurisprudence every other year.
Okay.
So, I like to, anytime I see something that's relevant and applies, I actually go out and take it. So I feel like I'm constantly learning and keeping things relevant and current.
Yeah, definitely expanding the horizon. Do you have one moment in your career that has been your proudest moment? And on top of that, do you have something that has been your biggest success?
Biggest success. Well, I would say overall, just getting done with the program and actually passing your boards, that's a huge pinnacle moment.
Of course.
Of your whole career, because all of that building up in your educational, preparedness, it really pays off at that time. You feel a great sense of accomplishment and success. And then right now, just going forward and getting my manual certification, that's my next professional goal. So I have goals, and each time I take a course and you get through it and you take the test, and you're that much more knowledgeable, and then you put it in practice and you're seeing the results. I think every day I see results through my patients is a success to me.
Of course.
So, we all can beat our heads and say, oh my God, I'm not getting success, but that's probably the biggest accomplishment. Just seeing how I'm benefiting my patients is the biggest success for me.
That's very nice. And then lastly, what part of your job do you enjoy the most? I know you were just saying seeing the little things, the progresses that patients make. Is that something that you would classify as being the one thing that you enjoy most about physical therapy, or is there something else?
I would say yes. Honestly, I love all aspects of it, and that comes across, many of our patients have been to other providers where they just don't get that sense of, the enthusiasm with what they're doing. And I have to say, because it was something I had chose later in life, and I really had to find what was my niche.
Yeah, your passion.
Yeah, and it is my passion. So I love every aspect. I've worked in every single setting. I've done, subacute, acute care, pediatrics, outpatient orthopedic is my passion. I do love outpatient the most, but I love every single aspect of it. I just love the flexibility and just the ability to work different facets of it. I just think in total it's a wonderful profession, and would highly recommend it to anybody, because it's a great profession to be in. You get so many different avenues. You get to meet so many different people.
It's rewarding.
It is. It's very rewarding.
All right. Well, thank you. That was great.
You're welcome.